Today I want to explore the question, to what extent should we prioritise public health over personal choice? And to answer that, I want to take you back in time to 1854, where there was a deadly cholera outbreak, killing just over 600 people within 10 days. Things were getting out of hand, people were panicking, and many did not know what to do. A scientist, however, named Dr. John Snow, decided to investigate this further. He used a system of epidemiology and street interviews to identify the source of the outbreak. And he identified a single cause, the Broad Street water pump in Soho. At the time, the idea was controversial. Many, including those in the medical profession, believed that disease was spread through bad air, hence the miasma theory. But Snow, he suspected differently, that cholera was a waterborne disease. So he presented his findings to the parish officials, and they were very sceptical. But with deaths rising, options running out, he had no choice to act, and he removed the handle from the pump. And deaths fell dramatically. But here's the thing, people weren't asked permission. In fact, many were angry. People didn't like the fact that they were restricted to their very own drinking water. Snow himself was criticised, and under public pressure, the handle was replaced. So let me ask you the question, was that the right thing to do? And more importantly, how far should we be willing to go in limiting personal choice to protect society? Even today, we believe the choices we make about our own bodies are entirely our own, from what we eat and what treatments we accept. But in reality, these are shaped by public health systems. Public health is the idea of protecting a large population of people from disease. They follow a preventative care approach aiming to reduce disease before it even begins. At its core, the theory behind this is utilitarianism, achieving the greatest good for the greatest number. But sometimes achieving that greater good comes at the cost of individual freedom. And historically, that's worked really well. Take public health reforms like the Public Health Act of 1875. This introduced clean water and sewage control to cities, preventing large outbreaks of disease that were rife in 19th century Victorian Britain, like cholera, dysentery, and typhus. These weren't optional, yet they were extremely transformative to society, and they saved millions of lives. And we see similar approaches today in most reforms. Take seatbelt laws and smoking bans. When they were first introduced, the public criticised this heavily. People didn't like the fact that they were being controlled over what they did in their very own cars, that they couldn't smoke in public spaces. But now the benefits become clear, because science has found just by wearing a seatbelt when you're driving, you reduce the risk of fatality by 50%. Also, scientists have found the dangers even caused by second-hand smoke to others. So we can see, although these were initially very unpopular, they were very beneficial to society. However, not all examples are that simple. Take water fluoridation. This is when fluoride, which is a naturally occurring mineral, is added to our tap water. And by doing this, it strengthens our teeth enamel and prevents tooth decay. This is vital because it reduces tooth decay in 30 to 40% of children, and this need is urgent. Currently, tooth decay remains one of the leading causes of hospital admissions in young children in the UK. And the NHS right now spends currently a whopping £40.7 million a year on tooth extractions. So you can see that water fluoridation is not just effective for our health, but economically viable as well. However, critics raise concerns. Unlike brushing teeth or choosing to visit a dentist, water fluoridation isn't optional. People consume it without explicit consent. And this raises a critical question. Shouldn't we choose what goes into our bodies? Let's look at a more famous example of vaccination. The HPV vaccine was a remarkable public health success. In countries where uptake was high, it reduced cervical cancer rates by 90%. Vaccines work by introducing a dead or weakened form of an antigen into the person's immune system, and this stimulates their immune system to produce antibodies and memory cells, which provides the basis of future immunity and protection from other attacks. However, at a population level, this contributes to herd immunity. This is when a large proportion of the population is vaccinated against disease. This reduces the spread of disease and infection, and protects more vulnerable and compromised individuals that can't get vaccinated for whatever reason. However, let's look at the COVID-19 vaccine. When it was first introduced, public vaccine mandates and passports limited where people could go, what restaurants they could visit, and what public spaces they could go to. Even their jobs were restricted to them. This meant if they didn't have the vaccine, they couldn't get a job. And on top of this raised a very important question. Were people truly choosing to be vaccinated or were they being pressured to? On top of this, side effects were reported. And although they were closely monitored, side effects like cold, fatigue, sore throat were reported. And on the rare end, stuff like myocarditis, which is a condition that affects our heart, was also reported. And this only fueled the fear and hesitancy and led to the rise of something known as the anti-vax movement, where misinformation and distrust have led people to reject vaccines altogether. But this has dangerous consequences, because when vaccination rates fall, herd immunity weakens and preventable diseases can easily return. So I think the hardest part about public health is that when it works, many don't see the outbreak they didn't cure. You only feel the restriction holding you back and how you felt at that time. So when we ask the question, to what extent should we prioritise public health over personal choice, the resistance we see isn't always a rejection of health itself, but also a crisis of communication understanding. Because you can't expect people to, defend a sacrifice they don't understand. So my view is this. Prioritising public health over personal choice is only justified when it meets three conditions. When the scientific evidence suggests it's necessary and safe to do so, with at least side effects as possible. When it doesn't just protect the harm of the individual, but protects the harm of others. And third, when it gives people as much freedom as possible and gives some community understanding. Because ultimately, this isn't just about health, but it's also about trust. I think giving too much freedom can risk collective harm, but too much control risks taking away the very autonomy we value. So maybe it's not just choosing between public health and personal choice, but finding that balance between them both. Because public health works best when we all trust and when we all believe. So I think